So, I currently actually work in Harrogate now, which has got the third worst health outcomes in the UK. So as you can imagine, it's a very, very challenging area. So when Heidi, the lovely lady from HR, came and introduced Woulgan to me, I was quite excited about it because we've got so many chronic wounds, we've got so many issues around wound healing. And what I like about it, and as you've heard, we've been just talking about the product, is that there's nothing like it on the market. It's really, really unique. The mode of action is completely different. And for me, within podiatry, triggering the patient's own healing process is really appealing. So how I try and explain it to the patient is, we're just trying to kickstart your white blood cells to get them to heal the wound. And you know, they're really, really, really keen to get involved and use it, particularly if they've had a wound for a number of months. And as you're aware, that patients get really low in mood, they get very depressed. They just think, I'm never going to get this wound to heal. So this kind of different type of dressing is like, yeah, it's really different. You know, and we do get in the habit of kind of, I don't know, does everyone get in the habit of using very similar dressings? You get in the process of trying lots of different things. So this is a really, really exciting innovation. Okay, so it can be used in high-risk patients and slow-healing wounds, so anything that's 4 weeks old. So obviously I'm going to talk about diabetic foot wounds, but you can use it within leg ulcers, pressure ulcers, burns. It can be used sort of light to moderate exudate levels. One of the key things that's really important is that we need about 20 to 25% of the wound bed to be exposed, just so that the product can actually get into contact with the wound bed. So it may be with certain wounds that you would need some debridement. And I think probably everyone in the audience has actually used a gel in the past, but this is a really different type of, because it's an active type of dressing, so it works very differently to a lot of the other gels that are actually on the market. It can be used in infected wounds, but as long as the patient is actually on antibiotic therapy as well. I've not actually yet used it with necrosis, but it can be used for that as well. But again, as long as we've got some of that wound bed exposed so that it actually works, it can get into contact with the wound bed. So I'm just going to talk through some case studies. These are all podiatry related, just because obviously that's my expertise. So case study 1 is Mr. Smith. So he's 80-year-old male. He's got type 2 diabetes, autoimmune hepatitis. So he's got significant motor neuropathy. His walking's really bad. You know, obviously he's got a lot of weakness in the muscles. Completely neuropathic from the knee downwards. And he actually had an acute episode with his PVD, so he got an occlusion. He ended up having a FEMPOT bypass. And unfortunately, he ended up with gangrene and had a 4-foot amputation. So this gentleman was started on negative pressure and obviously offloading, because with any wound, offloading is really, really key. 3 months after he had the negative pressure, the wound had reduced, lovely 100% granulation tissue. And he went through a number of different types of dressings, and we kind of had a process where the wound just really stalled. So 11 months old, this wound is 2.46 centimetres, covered by dull granulation tissue. We're stuck. Where do we go with that? So we started Woulgan. So there's the wound at week 0. So you can see that granulation tissue is quite dull there. Week 4 looks really good, doesn't it? Massive reduction in size, so 89%, which is absolutely amazing. And week 11, completely healed. So for a chap like that, who's had that wound for a year, you know, and we've just introduced that product, and over a short period of time, over 7 weeks, we've managed to get that healed. Okay, so case study 2, Mr. Hanson. So he's a 66-year-old male. Again, he's got diabetes, really poorly controlled, unstable angina. Again, he's neuropathic. They don't have that pain protection there. They're very, very prone to getting wounds like this from trauma. July 2018, he ended up with a severely infected forefoot, and it resulted in forefray amputation, which is a really tricky amputation. It's right in the middle of the foot. It's a nightmare. So again, he had 5 weeks of negative pressure. We got him offloaded. Again, he had lovely granulation tissue, quite a large wound, put 4.7 centimetres squared. We put Woulgan on, and within 2 weeks, we didn't need it anymore. So we'll have a look. So there's the wound. As you can see, it's so awkward, isn't it? Right in the middle of the foot. Look at that after 2 weeks. So again, we could just put a dry dressing over that. Really, really good. Really, really great for the patient. You know, really, really positive outcomes. And week 4, again, completely healed. You can see it's healed really, really nicely, really quickly. So this next chap, Mr. Jones. So Mr. Jones is one of my lovely Harrogate patients. His medical history, he's got type 2 diabetes, he was born with a club foot, so he's had numerous operations on his right foot, and he's got a really, really difficult wound. It's on the 5th metatarsal head, but it lies sort of on the lateral border. He's got painful neuropathy and hypertension. So the wound's been present since September 2017. He's had IV antibiotics, osteomyelitis, and I've been through lots of different dressings with him. I've offloaded him, and I've just found that I just got it stalled. It was 20 by 12, and I just couldn't budge it or move it. He was getting really, really low in mood, really depressed. He had to give up work. He's got a wife that's disabled, and I kind of thought, I was at my wit's end with it. You know, I thought, how am I going to get him to heal? And then Heidi came in and she said, Kim, do you want to try this new product? So I sat down with him and I said, this is how it works. Do you want to give it a go? And he said, Kim, I'd try anything. So this gentleman actually is involved in his care, so he self-manages. So the good thing about the Woulgan is it's in a nice small tube, and it's really, really easy to apply, and it's great for patients that are self-managing. There's nothing difficult or complex about it. So, like I say, we're in present since September 2017, so we commenced the Woulgan on the 10th of October. So the wound size I'm commencing, it's just been stuck at that 20 by 12 for quite a number of weeks. So you can see why I actually started it. And then the last time I saw him, which was last week, 31st of October, it was 5 by 7. So it's massive reduction in size. And one of the things that I really noticed with the product was the depth was better, the wound bed was cleaner, there was no maceration around the wound borders. And he's thrilled because he's not seen any changes in a while, so it really, really has lifted his spirits. And we're going to continue use until closure with that. So I'm seeing some really, really, really good results with this product. And it's just because of the way it works, because it is so very, very different. So my feedback from, I've been using it from the summer of this year, is it's just really, really easy to use. I've not found any peri-wound maceration. It can be used over tendons and bones safely. So I'm currently using it over an Achilles tendon wound at the minute. Absolutely fine, no problems. It aids autolytic debridement, so there are some patients who can't tolerate sharp debridement. So again, it's really effective in that as well. And again, I think because we do promote self-management with some patients, don't we? Particularly the ones that are middle-aged, some of them might still be working. Even some of the elderly patients don't want to constantly be coming to clinic. So again, it's really, really simple for patients to use. They can apply it really easily. We have a number of homeless patients as well, so it'd be something that, because it's a nice small tube that they can actually take with them and self-manage. So I'm just really excited about it. I think it's just a really fantastic product, and I think it's really going to change the way that we practice in North Manchester. We've currently got a strategy at the moment where we're looking at trying to heal our wounds within 4 weeks. And I really do think that this product will play a big role in that, definitely, in our pathway going forward. Okay. Thank you.